very welcome to Cork, the Republic of Cork, the true capital of Ireland, on the banks of the River Lee, where Sean O'Shea sings on Puckered Willa, where if you listen on a soft day like today, you might hear interspersed between Shandon bells, Jimmy Crowley singing The Boys of Fair Hill. So you're very welcome, but you're welcome because I feel it's a recognition by you, the patient group, the most important people with this disease, of the work that's performed here by my colleagues in looking after predominantly the patients from the south of Ireland. It is disappointing at times in the national press that there's little recognition of what happens in this unit here. We are part of a satellite of a bigger unit in Dublin, but I think it's important that there is recognition for the confidence and trust of the patients that are being treated here by us. So thank you for coming in such large numbers this morning. My journey with neuroendocrine tumours began actually in this hospital. I trained here as a surgical SHO and registrar, and probably the first patients I came across, from what I can recall, and I've thought about this over the last few months, are patients who had neuroendocrine tumours of their appendix. And I remember that it was always a novelty. We'd get a report from the pathologist, we'd look at this, there'd be some discussion. There was sort of a paper that had appeared, I think at that time, in the British Journal of Surgery, indicating which patients required further treatment in terms of a right-handed colectomy, or which patients could be observed. But there were no really guidelines there. And it was the beginning of a journey that took me through my training ultimately to Edinburgh, where I worked in the liver transplant and hepatobiliary unit, where it was slightly more formalised. The surgeons would meet with the radiologists. Often we would see patients with metastatic or secondary disease from neuroendocrine tumours to their liver. And the question often arose then, do these patients need to be operated on, or are there other forms of treatment? But it wasn't really until I came to the Freeman Hospital in Newcastle that a formal multidisciplinary team approach to the management of neuroendocrine tumours was in play. And this was driven by two very enthusiastic gastroenterologist and endocrinologist, Andy James and Petros Paros. And it was the first time I saw surgeons sitting down with gastroenterologists, sitting down with endocrinologists, sitting down with radiologists, sitting down with oncologists and with radiation oncologists, and having a discussion about each individual patient that we were to see. And what actually happened was we were given a rota when I came, that every 2 weeks there was a neuroendocrine clinic. The patients that were coming to that neuroendocrine clinic would come at 11 o'clock. We would be there at 9 o'clock in the morning, and the first 2 hours of that clinic would be spent actually going through the notes, looking at the radiology in a multidisciplinary team setting. And when I left Newcastle to come to Cork to start a hepatobiliary unit here, of course, patients with neuroendocrine tumours started to come through my door. And there was no formal way there was no formal method or multidisciplinary team approach at that time here in Cork to assess patients like that. And having come from what really was, a stellar, enthusiastic, forward-thinking unit in the Freeman Hospital, it was quite a challenge to see what we would do here to look after patients like this, and to do it on a par with what I had been exposed to previously. So as part of that, we established back in 2009 a Southern Cancer Symposium on foregut cancers. So this was a meeting where every year we would invite international experts over in the fields of upper gastrointestinal tract cancers to come and as a multidisciplinary team meeting and discuss patients with esophageal cancer, gastric cancer. And in 2011, we held a meeting, an international meeting on neuroendocrine tumours. We had some really stellar panel. Anders Sundin was there from Stockholm, Jan Mortensen, who's the chief of nuclear medicine in Copenhagen, Dushan Suhani, who's a very good friend of mine, a consultant radiologist in Mass General, Massimo Falcone, one of the surgeons from Verona, Derek Manis, my old boss from Newcastle, Dan Granberg was here, Martin van Essen from Rotterdam. And it was a fantastic opportunity to concentrate minds of people here in Cork who were looking at patients with neuroendocrine tumours, treating them, but it was to bring everybody together. And as part of that meeting, we also had a patient forum. And it really struck me at the patient forum, it was very similar to what's going to happen later on today. The experts, the international experts, were brought to a meeting place, and patients were literally able to ask any questions they wished of the expert panel. So that was the spark that really started a multidisciplinary team approach. Derek Power, my oncology colleague here in Cork, is going to speak a little bit more about how that unit developed. But I want to say that from my point of view, and I think this is important to say, that the word expert is constantly thrown out there. I'm not an expert on neuroendocrine disease. Barbara Erickson is an expert on neuroendocrine. Dermot O'Toole is an expert on neuroendocrine. I'm a hepatobiliary pancreatic surgeon who has an interest in and who treats a significant number of patients with neuroendocrine and who is constantly learning in this field. And the learning curve, I think when you're in this field, you realize that the more patients that are under your care, the more patients that you are seeing, and these patients are here for a very long time, many of them, you learn from that. You get a feel for what's going on. So one of the greatest learning experiences I had was a meeting that was organised, in fact, by Dermot O'Toole earlier this year, the Net Connect meeting in Dublin, which was really a fantastic meeting where people interested in neuroendocrine disease or who treat neuroendocrine disease right around the world came to Dublin and cases were discussed. And I was paired with an oncologist at that time, Juan Vallon from the Christie in Manchester. And for me, preparing for that and being in the company there and the questions that were being asked by people who were actually treating neuroendocrine patients was a fantastic learning experience. Why are hepatobiliary pancreatic surgeons involved in this disease? Well, I suppose by the nature, much of this disease occurs in either the pancreas or the liver. There is an expertise in dealing with vascular structures, so it is probably by default that hepatobiliary surgeons develop or have an interest in this area. But it is very much a multidisciplinary team approach that needs to be adopted in seeing that patients are given the best treatment options. I welcome this patient group wholeheartedly. I think it's a very welcome development. I see this as an opportunity for you who are affected by this disease to, learn who the people in the field in this country are. I think it allows for a degree of intimacy in the sense that it's a forum whereby we can freely talk to each other out with a consultation setting. I see you also as a pressure group. I think you are watching what we're doing. I think you're our patients, so we know through you and you know through each other how you are getting on. You can compare with other patients or with patients overseas, and I think that's a good thing for us. I think it's important that we have that if you like, check to what we do with you. I think it's important also that if there are difficulties that we encounter in the management of this disease in this country, that it is a forum like this that we discuss this and not through the press. I think that much more can be achieved through diplomacy, through open dialogue, than through the open press. I also see you as a very important group for potentially raising funds. There are many things that we have difficulty with in getting funding from our health services, clinical nurse specialists, setting up databases, and so on. And the more patients we start treating, and we are treating more and more patients, it's not just the treatment of the patients, but it is in particular the follow-up of those patients that is extremely time-consuming and very, very important. And it's the funding for that and the guidance and governance of that is of concern to me. So you're very welcome. This is an opening address. I've spoken from the heart, from the things that I want to say. We've excellent relationships, and I want to emphasise that because this has sort of been mentioned in the past with our colleagues in Dublin, particularly with Dermot O'Toole and with Justin Gagan, whom Justin and I worked together here in this hospital many, many years ago, and we've many stories that perhaps over a cup of coffee we can tell you, but are not suitable for a formal address like this.